Hi there, my name is Neha Shah, and I'm a registered dietitian specializing in IBD and other gastrointestinal disorders, GI, for the past 15 years, a really long time. In a nutshell, I'm currently at UCSS specializing in IBD, short bowel syndrome, and other GI disorders for the past year. Before that, I was at Stanford Healthcare for 15 years, where I was that newbie dietitian once upon a time, fresh out of my dietetic internship, and surely enough, over the years, I built my GI nutrition specialty there. While I was there, as one of my initiatives, I built nutrition services for the Digestive Health Center there, which was such a great experience because I was the first dietitian to bring such a needed service there. I also own a private practice. I just wanted to bring specialized nutrition care to individuals with IBD in the community who are having trouble finding a specialized dietitian to work with. So overall, my purpose then and now is to give them a home for nutrition care. Beyond taking care of my patients, I like to write. I have co-authored articles on the role of diet in IBD because I think it's an important topic to write about. And certainly I'm involved with several professional GI organizations, such as the Northern California Crohn's and Colitis Medical Advisory Committee, to work on nutrition-related projects. I like to be involved in these different areas because it helps me move IBD nutrition care forward. So what inspired me to become an IBD dietitian? For one, I believe that our health starts with our gut. You know, our nutrients from our diet, it's the way they enter into our body. I've always been fascinated with how nutrients interact with the GI tract through digestion and absorption as some of the ways. As we all know, inflammation from IBD causes changes in the GI tract, may cause poor digestion and absorption as one of those changes, leading to weight loss, symptoms of diarrhea, or vitamin deficiencies, or even how, foods are tolerated. We can do so much with diet to help address this. Specializing in IBD gives me a chance to help my patients understand the changes that are occurring with the GI tract and help them learn how to modify the diet to reduce the impact. Those with IBD may have weight loss or may not tolerate their once favorite food due to pain or, having a sudden rush to the restroom. The relationship with foods then can change as feeling sick is associated with eating. There are a lot of questions on how diet can play a role with IBD or how diet can play a role in treatment of IBD. Simply put, a dietitian specialized in IBD knows the ins and outs of IBD to personalize nutrition care. An IBD dietitian knows the latest updates on diet research in IBD to clarify approach there, or can troubleshoot the diet along with eating habits to help reduce symptoms, or even deal with, those who will be undergoing bowel surgery to address nutrition for an ostomy or help with recovery afterwards. An IBD dietitian should be involved with all aspects of care at the time of diagnosis, during a flare, during a remission, or if undergoing or dealing with nutrition issues from surgery. So on a professional end, my typical day involves doing one-on-one sessions with my patients. A typical session may involve teaching my patients how to identify food triggers within the diet or how to try new foods with the right portions to reduce the risk of symptoms, or how to eat in different environments, such as at work or at a friend's home, while traveling, in a restaurant, and overall how to build diet over the time, including trust. On some days, I work on projects related to IBD, such as writing sections for an article or preparing for a nutrition webinar, or powwowing with other healthcare providers on how to move nutrition research forward in IBD. On a personal end, my typical day includes making sure I do something nice for myself every day, such as watching something funny on TV before I go to bed. My IBD patient the other day told me I'm no longer afraid to eat. It is huge. It is very rewarding when I see my patients overcome their fears and become more confident in their food choices, especially when my patients they are able to troubleshoot their own nutrition issues or bring their own ideas forward on how to expand their diet. Then I know I help them get to a place where they feel empowered. Now, this is to the patient directly. First and foremost, diet and nutrition matters in IBD. Do not let anyone tell you differently. Foods are trial and error. What worked well for others may not necessarily work for you. It is important for you to ask your IBD medical team if there is an IBD dietitian available that you can work with at the start of your care, throughout your care, to help address any nutrition issues that may come up, such as weight loss or changes in how you tolerate your foods. Do not wait. And overall, I want you to feel empowered to make food choices that are appropriate for your IBD, your culture, and your lifestyle so we can move your nutrition and health forward.